Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, here we are preparing questions for DSSSB exam and also preparing questions for CHO and NHM Exam Preparation. All questions are from previous year question papers. Surely this question will helpful for your studies. First question, the major class of immunoglobulin present in human serum is? Options, option A IgM, option B IgG, option C IgE and option D IgD. The immunoglobulin present in human serum is IgG. Option B is the correct answer. The most abundant immunoglobulin is IgG. It can cross the placenta. IgG can cross the placenta and also this IgG are antibodies related to secondary immune response. Here our question, immunoglobulin present in human serum is IgG. The next question, at which week embryo can be differentiated as human? Options, option A 4th week, option B 6th week, option C 8th week, option D 2nd week. Embryo can be differentiated as human at 8th week. Option C is the correct answer. The next question, PEG cells are seen in options, option A intestine, option B stomach, option C fallopian tube, option D vagina. PEG cells are found in fallopian tube. Option C is the correct answer. PEG cells are non-ciliated epithelial cells which is present in the lining of the fallopian tube. Okay. So, our answer is option C, fallopian tube. And the next question, length of cervix is? Options, option A 3.5 cm, option B 4.5 cm, option C 2.5 cm and option D 1.5 cm. Length of cervix is 2.5 cm. Option C is the correct answer. Move on to the next question. While providing oral care to a retropositive patient, the nurse should option A use special mouthwash, option B use soft toothbrush, option C isolate the client and option D wear gloves. So while giving oral care to a HIV positive patient, we should wear gloves. Option D is the correct answer. The next question, while taking temperature to a HIV positive patient, the nurse should option A wear PPE kit, option B wear mask and gloves, option C use 1% hypochlorite solution, option D wash hands before and after procedure. While taking temperature to a HIV positive patient, we should wash hands before and after the procedure. Option D is the correct answer. In the previous question, while giving oral care, so we are touching the patient, so we should wear the gloves. Here we should wash the hands before and after procedure. The next question, the most preferred site of intramuscular injections in infants and children. Options, option A deltoid site, option B vastus lateralis, option C ventrogluteal site, option D dorsogluteal site. And the correct answer is option B, vastus lateralis is the preferred site for intramuscular injections in infants and children. And the next question, fallopian tube is lined by which epithelium? That is the question. So options, option A columnar epithelium, option B stratified epithelium, option C ciliated epithelium and option D germinal epithelium. And the correct answer is option C ciliated epithelium which is lined by fallopian tube. And the next question, length of fallopian tube is range from options, option A 5 to 7 cm, option B 7 to 12 cm, option C 12 to 15 cm and option D 15 to 20 cm. Length of fallopian tube is correct answer is option B 7 to 12 cm. The next question, uterus with depression at the fundus is called. Options, option A, accurate uterus, option B, separate uterus, option C, bicornuate uterus, and option D, none of this. Correct answer is option A, accurate uterus. Depression at the fundus of the uterus. Fundus means the uppermost part of the uterus. So, the depression at the uppermost part of the uterus is known as accurate uterus. Option A is the correct answer. And the next question, which heart disease is most commonly associated with rubella infection? Option A, patent ductus arteriosus, option B, ventricular septal defect, option C, atrial septal defect, and option D, all of this. Correct answer is option A, patent ductus arteriosus. Heart disease most commonly associated with rubella infection is patent ductus arteriosus. Option A is the correct answer. And the next question, most commonly affected valve in rheumatic heart disease is. Options, option A, tricuspid valve, option B, aortic valve, option C, mitral valve, option D, pulmonic valve. And the correct answer is option C, mitral valve. The valve which is most commonly affected in rheumatic heart disease. And the next question, a student nurse is learning to assess blood pressure. What does the blood pressure means? Options, option A, flow of blood through the circulation, option B, force of blood against the arterial wall, option C, force of blood against the venous wall, option D, force of blood through the heart. And the correct answer is option B, force of blood against the arterial wall. Here question is, a student nurse is learning to assess or to take blood pressure. So what she should understand? She should understand that the blood pressure means force of blood against the arterial wall. And the next question, anesthetic agent contraindicated in hypertensive is. Options, option A, propofol, option B, ketamine, option C, thiopentone, option D, diazepam. Which anesthetic agent is contraindicated in hypertensive patient? Correct answer is option B, ketamine. Move on to the next question. Who is the father of modern anesthesia? Options, option A, W.T.G. Morton, option B, Pasteur, option C, Clark, option D, Freud. Father of modern anesthesia is option A, William T.G. Morton or William Morton is the correct answer.